I'm here just outside Haven House Children's Hospice. I clearly can't go in. People who are not directly involved can't, obviously given the terrible threat that COVID-19 coronavirus will pose to those inside the hospice. But I'm here because I'm going to be talking to Mike Palfreman, the Chief Executive, about how things are running at the moment and what the future looks like here, given all the deep difficulties that we face at the moment. Mike, it's good to get you on the line. I've really got three questions to ask you, which may help those who watch this understand how the hospice is working at the moment. With all these difficulties, perhaps you could explain to us how is the hospice working and what are the difficulties you face?
Hello, Iain. It's really good to see you. It's also really good to see the gates of the hospice. I, like several of our staff, have been working from home for the last 3 or 4 weeks. So we've only really got a core care staff and housekeeping staff on site at the moment. And yeah, it's pretty challenging times. We've furloughed a number of staff. On the care side, I would say our services are as much in demand, if not more so than ever, and we're working very closely with the NHS to get non-COVID children out of hospital, whether it's children at end of life, step down, emergency respite, and really working with the NHS to try and help free up beds and take some of the pressures off the front line. Our fundraising and retail, on the other hand, is a very different story. Our shops are closed, our fundraising events are cancelled for the foreseeable future. We're projecting a loss in income of up to £500,000, so it's pretty significant. And in fact, the whole environment is the most challenging I can recall in my entire 60 years. So yeah, it's tough.
Mike, we just had an announcement about extra money going to the voluntary sector, something we've all campaigned for, over 700 million. This, I hope, will be a real support to you, as it was very specifically also named that this would support hospices. Perhaps you could explain how this might work and how you're going to be able to get the money and what you'll use it for.
Yes, the Chancellor, as you know, announced a package for charities the other day, including a 200 million fund for hospices. And I think that was reflecting the importance of the hospice movement as a support to the NHS. Now, that's been worked on by our umbrella organisations, Hospice UK and Together for Short Lives, and I know many MPs, including very much yourself, have been talking behind the scenes and helping to make this happen. So we're very grateful. We are very pleased. It's most definitely a positive move. What we do not know yet, and probably won't know till next week, is exactly what it means to Haven House. So we're waiting with bated breath on that. It is most definitely a positive move. It will, of course, only cover the next period, and that still leaves us uncertain in terms of the medium to longer term. But a positive move nonetheless. Thank you.
That's great, Mike. And I know, though, even going beyond this, the fall off in support for charities and organisations like yourselves, particularly hospices, which receive a very much lower level of funding and hugely rely on charitable giving. Going forward, how are you going to meet some of the demands that will be required once we get through COVID to tide you over until we can get back to the normal funding levels that would exist? I understand you have an emergency charity appeal. Perhaps you could explain how that's going to work.
Yes, our emergency appeal is running and it's going well, though we need to keep pushing it along. We've also been trying to be a bit more creative around our fundraising, recognising that we can't run public events. And another of our extremely good patrons, Ben Shepherd, you know, helped us by hosting an online quiz the other evening, earlier this week. It was all put together at very late notice, and we had 300 teams participating online, and it was a fantastic evening, and we're hoping we'll do some more of that along the way. In terms of the medium to long term, when we come out of this crisis, we would love to be in a position to pick up as we left off, but as we all know, the future is very, very uncertain at the moment, and we don't know what the country or the world is going to look like at the end of all of this. And that's why the support of terrific patrons like you and the support of our local community, which has also been fantastic, will continue to be crucial. So if I could just use this medium to say, please, anyone watching this, do tap into our website, havenhouse.org.uk, take a look at our emergency appeal, take a look at all the good things we're continuing to do in support of the NHS, as well as in support of our children and families, and do what you can to help us. It's going to be vital. Thanks, Iain.
Thanks indeed for that, Mike. And it's important for those watching, if you are able to, if you click on the link below, you should be able to get to the support, and if you can give, they'll all be very grateful. And the most important thing we need to remember is that Haven House and other hospices like it, both adult and children's hospices, they take an enormous pressure off the health service. If they were not here, many of those children, many of the adults would actually end up inside the hospitals, putting greater pressure on hospitals at this critical time. So it's really important that we continue to support this. Mike, I want to thank you, but I particularly want you to pass on our thanks to all the nurses and all the staff that are working together for all their work that they do to support those families. I'm really proud that you're here in the constituency, and I know many, many others who live here are as well. Thank you.